Well, it looks like we have about 1 minute until noon, so we'll give people a couple more minutes. But for those of you that weren't on before, if you wouldn't mind putting your name and organization into the chat. And if there is a group of you listening together, you can just list them all under one entry, and then even maybe include position, if they're a nurse, quality leader, therapies, those kinds of things. That'd be helpful. Thanks.
Your name, where you're from, and what your title is.
Can you hear me?
I can.
Great. I'm Suzanne Zarnik. I'm from Merrick Medical, and I'm a nurse on the acute floor.
Great, thank you. All right, well, it's officially noon, so we'll just go ahead and get started because I know everybody has a ton going on. My name is Dana Steiner, for those of you that don't know me. I am the HQIC Program Director for the Nebraska Hospital Association. So I work with most of your organizations on the HQIC project, which is a CMS-funded quality improvement project that is supposed to decrease the number of harms that occur in a hospital. So as we think of harms, you can think of it in a lot of different ways, but anything that is not planned that happens to somebody in a hospital that causes them to stay longer or be injured is considered a harm. So one of the big ones we see or work on really preventing is falls. And so the next few months, we're going to spend some really focused time looking at falls programming and just making sure that there's a strong background for fall prevention within your organizations. Don't forget, keep your line on mute throughout the program unless you want to ask a question or speak. It just really decreases that chatter in the back so we can hear the speakers. I said it before, but just a reminder, if you have a group with you, put all of your names in the chat for me so that I can track who all participated. And otherwise, if there's no other questions, that's kind of my little housekeeping pieces. I would like to turn it over to the Capture Falls team, and I will let them do their own introductions because they know it far better than me, but we're really excited to work closely with them as they are the experts in fall prevention in our state and have done a ton of work already. So looking forward to working with them closely. And Vicki, I think, is our first speaker, so I will hand off to her.
Thanks, Dana. Can you hear me all right?
I can, yep.
Okay, great. Thanks, Dana. Well, we'll go ahead and get started since we have about 45 minutes for our session today. Here's a quick overview of our 3-month rapid cycle improvement project that will focus on falls. So our session today is sort of our kickoff session for this 3-month rapid cycle improvement project. We'll talk about just some overarching goals for the program, a couple of tips on creating your team to manage, to address falls within this cohort. And then we'll introduce you to the importance of conducting a gap analysis for fall risk reductions. And I'll provide some instructions for you on how to complete that in preparation for some of our future sessions. I want to do a quick acknowledgement for the team here at UNMC. So we have been helping with the Capture Falls program for several years, and we've received funding from both the Agency for Healthcare Research and Quality to start the program, and continued support from the Medicare Rural Hospital Flexibility Program from the Office of Rural Health from the state. So a big thank you to those funding agencies that have allowed us to put this program together and disseminate it widely across the state. In addition to our partnership with Dana, here's the members of our UNMC team. I'll be taking the lead on the presentation today, but the other members of our team are Dawn Benema, who is our resident fall risk reduction expert. She is a physical therapist by training. We have Ian Skinner, who is a health informaticist and data analyst. who has expertise in all things related to data and patient safety and quality improvement. Myself, Vicki Kennel, I am an organizational psychologist by training, with expertise in things like teamwork, human behavior, organizational science, and patient safety and quality improvement. And then we also have a OT student who is very close to graduating. Her name is Janae Murray on our team as well. She's a research assistant and has played a critical role in helping Anne with many of the data elements of our project. So for those unfamiliar with what we mean by Capture Falls, so Capture is actually an acronym that stands for collaboration and proactive teamwork used to reduce falls. So we promote a team-based approach to addressing a complex issue like falls. And so I will talk a little bit today about the composition of your team and who you might want to engage with you throughout this learning cohort. We're also, marrying our Capture Falls approach with a framework for quality improvement. You may utilize a different framework, but the framework will integrate throughout this 90-day rapid cycle project is the model for improvement that's well publicized by the Institute for Healthcare Improvement. And so this particular model helps you to answer 3 questions. What are we trying to accomplish? How will we know that our change is an improvement? And then what change can we make that will actually result in improvement? Followed by a series of plan, do, study, act cycles to help translate our change ideas into hopefully the reality of an actual improvement in the outcomes we're interested in. So our session today are really just going to be focusing on that very first question of trying to think about what is it that we're trying to accomplish. So one of the first steps, I'll go back a slide just a second. So within our model for improvement, one of the elements that isn't added in the specific model is actually a step we engage in prior to starting to answer some of these questions, which is establishing a team for your improvement effort. Many of you have been turning in your team composition sheets to Dana, so thank you for doing that for us. Within the Capture Falls approach, kind of one of the hallmarks of our approach is we highly recommend having an interprofessional team within your facility to help you address the issue of fall risk reduction. We have primarily worked with small rural critical access hospitals across the state. So the composition of many of those fall teams includes representatives from nursing, rehabilitation therapies, that may be PT or OT, depending on who's available in the facility, engaging with pharmacy, having participation from quality improvement, patient safety, and or risk management, depending on what that looks like in your facility. And then as available, engaging with physicians or physician assistants as well, if those individuals are able and willing to participate. But your team may look much different than this as well. There may be other key stakeholders you want to engage, individuals from leadership who can help to make sure they can advocate on your behalf, help to secure resources and support for your efforts. We strongly encourage you to have some bedside champions, so individuals who are role models, well-respected on the patient care floor, who can help to serve as champions to disseminate and encourage implementation of new practices at the bedside for fall risk reduction. You may have other individuals from different specialty care areas, surgery, OB, any one or more of those specialty care areas, especially if you identify some fall risk reduction specific challenges in any one patient care area. Some teams have also engaged individuals from environmental services, as they spend quite a bit of time in patient rooms, facilities management, and also information technology as well. This list is probably not fully inclusive of all individuals you may engage at some point in time with your fall risk reduction efforts. but should at least get you started thinking about the individuals and the expertise that you might want to bring to the table and participate in your team. Once we've identified what your specific needs are and the areas you'd like to focus on for this 90-day rapid cycle improvement project. So once we have our team established, our next step is to start to identify what are the specific needs that we have for fall risk reduction that we'd like to focus on. And again, within this cohort, knowing that we're focusing on this somewhat intensely for a 90-day time period. There will probably be many things you identify that you'd like to change, but we'll want to focus our efforts in on things that we can actually address within a 90-day time frame. So to do that, a tool we can use within our quality improvement approach is to conduct a gap analysis. So a gap analysis in healthcare is really intended to help us identify gaps in practices, processes, services that we offer. And looking at instances where what is actually happening is falling short of what should be happening or what we'd like to see happening. So we can use a gap analysis to help us review the state of a program and really help us to identify what are some of the strengths that we have in our practices, but also what are some of those gaps in current practices as they compare to best practices or what we know from the evidence base to be kind of the gold standard at this point in time. So many agencies, including the Agency for Healthcare Research and Quality, recommend conducting a gap analysis as an initial step in implementing a robust fall risk reduction program. But it's also an opportunity to help you to periodically revisit the state of your program, to identify areas where you might have some sustained strengths where you're doing really well, or areas that present some new or are some continuous challenges for improvement. So ultimately that gap analysis can give us insight into areas where we need improvement, areas where we might have some weaknesses or some shortcomings to address. It'll help us identify areas where we can really place our resources and our time and our energy, and also can help us uncover some differences in perceptions of what we think is happening versus the reality of what is actually happening. So to put this in the context of our quality improvement approach or methodology, a gap analysis is just one of many tools that can be useful in the early stages of these quality improvement initiatives. So within our model for improvement, it's a tool that can get us a little bit closer to answering that question, what is it that we're trying to accomplish? If you are typically using other methodologies like the DMAIC approach, which is consistent with the Six Sigma work, it can help us with that very first step of trying to define the problem that we want to focus on for our improvement efforts. So who should we engage when we're conducting a gap analysis for our fall risk reduction program? So depending on the scope of your gap analysis, and what we'll have you do in this cohort is a pretty broad, like high level overview of your entire fall risk reduction program. You're going to want to engage individuals who are knowledgeable about your fall risk reduction program as it exists right now, and also individuals who have a good understanding of the processes that occur at the bedside, because they can give us some insight into the reality of how well our current policies and procedures are being translated into action at the bedside. So you may want to engage individuals from your interprofessional fall risk reduction team to help you complete a gap analysis, again, staff working at the bedside, and any other key stakeholders in fall risk reduction within your facility that you'd like to engage with you to complete the gap analysis. once you know who you want to engage to help you complete this, you might also want to consider gathering any existing data or information that you have about your program that can help to inform you of that reality of the current state of what's going on. So I want to be crystal clear with this slide that you do not need to go out and proactively collect all the information that's listed on this slide. Use whatever information you might have at the moment to help inform your gap analysis. So information that could be helpful are things like an existing copy of your fall risk reduction policies and procedures that you have on hand, whatever definition your facility has adopted to define what we mean by a fall, a list of fall risk reduction interventions that are available to staff to use in an effort to reduce patient fall risk. And then any fall rates that you have from the last couple of years would be helpful information as you prepare to conduct your gap analysis. Other information that can be useful to inform that reality of the current state of where things are at. Any existing process audit data that you have that you've collected related to implementation of fall risk reduction interventions and practices at the bedside. If you have any existing workflow or process maps that are related to fall risk reduction practices, those can be helpful. If there's information you might glean from fall incident reports or post-fall huddle documentation, and then any other informal conversations you might have had with staff or feedback from staff, even guidance from or feedback from the Patient Family Advisory Council. Any one of these sources of information can help to inform what that current state is of our fall risk reduction program. So again, you don't need to go out and proactively collect all this information, but if you have any of this on hand, it will be helpful to help you get a sense of what that current state is of your program. We also caution people and just remind you that there's really little benefit to your improvement efforts and ultimately to the safety of your patients to conduct a gap analysis with what we call rose-colored glasses. So obviously we want to highlight and celebrate areas where our practices are aligned with best practices in the evidence base and where we're reliably and consistently implementing those practices. But we also encourage people to take off those rose-colored glasses so that you can see the current state for what its reality is, not necessarily what we hope it is. That's why we're engaging in an initiative like this, so that and why we engage in quality improvement is to take our current state and shift it a little bit further and closer toward our target goals. So some practices on a fall risk reduction gap analysis are going to be questions like simply yes or no, like we have this in place or we don't. So for example, you might have a fall risk reduction tool in place. So check for that, that would be considered a best practice. But we also want to ask ourselves, follow-up questions like how reliably does staff complete a fall risk assessment for patients in our facility per our policies and procedures. So it takes us beyond just this practice is in place, but really how well are we actually doing this in practice? So most of the questions on our gap analysis are going to focus on kind of the, no, we don't have this in place. Yes, we do, but we could certainly do this better. Or yes, and we do this particular practice really well. And then throughout the 90-day rapid cycle improvement approach, we're going to take a deeper dive into areas where we might have opportunities to do those things better, or we aren't actually doing them at all. So we'll be able to take a deeper dive into that throughout the rest of this 90-day rapid cycle improvement approach. So final question is, what do we assess in a gap analysis? As I mentioned, we'll be focusing on a very broad overview of multiple components of your broader fall risk reduction program. I'm kind of showing you what we've done within the Capture Falls approach. Other ways you can approach a gap analysis is to really take a deeper dive into a specific area of focus, like a fall risk assessment and all things related to that, or fall risk reduction interventions and all things related to that. But our focus to start off with this project or with this rapid cycle improvement project is to look broadly across the current state of your program and the multiple aspects that go into that. So what you'll see within our gap analysis and some of the questions we'll ask, we'll address several of the following areas. So the first is something we talked about earlier, which is, do you have a team in place to help manage your fall risk reduction program? And ideally that team is interprofessional, and what professions or roles are represented on that team. We also ask a simple question of when was the last time you conducted a gap analysis for your program? Revisiting that information can be helpful to help us see how we're sort of shifting the needle and improving our practices over time. We ask about the presence or absence of some sort of formal action plan where your team is documenting and monitoring the steps that your team needs to take to help reach your program goals. We ask about fall risk reduction policies and procedures. So do you have those in place? Are they updated as needed? And are staff provided with education on these policies and procedures so that they're aware of what those policies and procedures are? We also address your definition of a fall, because that helps us to specify what counts as a fall and differentiates different types of falls you may see in your facility, whether those are assisted versus unassisted, as well as whether a fall resulted in some form of injury or not. So we ask questions about, do you have a standardized definition of a fall? If so, what is that definition? And are you providing education to staff on that definition? So we all have a shared understanding of what we mean by a fall in our facility. Then we jump to a lot of practices that happen at the bedside. So conducting a fall risk assessment to identify patients who are at risk for falls and help us to recognize some of those patients' specific risk factors. So we ask a series of questions about if you have a fall risk assessment tool, are you providing education to staff on how to use that tool appropriately and reliably as well? And are staff actually consistently utilizing your tool to screen patients for fall risk factors? We have several questions that look at kind of the bundles of fall risk reduction interventions and individual interventions you might use to help influence and patient fall risk factors in an effort to reduce the risk of falls. So what types of interventions are available for staff to use? Are these interventions linked to specific identified risk factors? Education that we're providing to staff on how to use those interventions, and are staff reliably using those interventions as are intended by your policies and procedures? We also ask them a couple questions about auditing programs, so auditing fall risk reduction practices to help us identify if those practices we have in place are being implemented as intended in your facility. So are you conducting audits to monitor adherence to fall risk reduction practices and communicating the results of those audits to staff so we can close the loop and use auditing as a tool to help us, reach our target benchmarks and our goals as well. We have a couple questions about a post-fall clinical assessment. So thinking of this as a protocol to guide staff in the assessment of patients for the potential for injury after a fall occurs. So do we have a post-fall clinical assessment protocol in place? Do staff receive education on that protocol? And is that protocol being utilized after every patient fall? We also are big proponents of what we call the post-fall huddle, which is where we engage members of our team to try to understand the story behind the fall, to learn about it, and to try to take action quickly so we can try to prevent a future fall for that particular patient. So we ask a few questions about if you've adopted post-fall huddles, specific tools or a process you have in place? Do staff receive education on that? And are these reliably conducted after every fall that occurs? And then we jump to some more kind of the outcome focus, which is related to reporting fall events, tracking fall rates over time, and learning from the data that you collect about your fall program, whether that's processes and or outcomes, and using that data to help you make data-driven and informed decisions about what changes you should make to your program moving forward. So within this, we have a few questions about do you use a reporting form specific to falls? Are staff educated on the process to complete that? And the extent to which you feel that staff are actually reporting all types of falls in your facility, any combination of assisted and unassisted and injurious and non-injurious falls. And then we also ask about inpatient fall rates as well. We have a specific calculator that you can utilize to help with the calculation of that. So that's the kind of 30,000 foot view, you could say, of many best practices and evidence. Some are evidence-based as well that should be integrated into your fall risk reduction program. So we set the stage for all of this and are focusing on this for our first presentation and our kickoff session for this cohort. As your first homework assignment is to actually complete a fall risk reduction gap analysis for fall risk reduction practices in your facility. So you'll be receiving an invitation via email. It will actually come from me. So it'll come from my email is victoria.kennel@unmc.edu. And that should be hitting your inboxes today sometime around 12:45, assuming the system works as intended. We would like your team to complete this fall risk reduction gap analysis because we'll use the information collectively from the cohort to identify areas where we're performing really well, identify areas where there will be opportunities for improvement, and can utilize that information to help structure the education and guidance we'll provide as we move forward in this cohort so that it can be useful to you and help to meet you where you're at with your specific needs for improvement. So this invitation to complete the gap analysis that you'll receive via email, this will be sent to the your HQuick Falls Learning Cohort team key contact. So one person from your facility will receive a link to complete the gap analysis. We only need one gap analysis for your facility, so that you don't need to have multiple team members fill this out. So to streamline that process, that will be sent to your team key contact that was indicated for this HQuick learning cohort. We'd like for you to complete the gap analysis by Wednesday, August 18th, which is when we'll be meeting again. I think that's our second session. That way will give us some time to review all of the gap analysis information we're receiving and be able to identify some directions to target the education and the efforts in this cohort to meet your needs as we move forward. So the gap analysis was completed online. It's through a system called REDCap, which is a HIPAA compliant secure system we can utilize to collect survey data. A couple pieces I want to mention. You can save your progress within the system and return later. So if you want to get started with your gap analysis and then want to ask questions or engage other team members or look for additional information as you're answering the questions, no, you can save your progress and return later. I believe you have a copy of the slides, and within the slides, I tried to take some screenshots and show exactly what you'll see as you tell the system that you want to save and return later. So it'll give you a return code you can utilize, and then we'll send you an email with a link where you can access your assessment and essentially pick back up where you left off so that you don't have to stop and then restart completely over again. So the specific instructions to save your progress in the system and return letter return later are available in the slides. Obviously, if you run into any issues, please contact us and we'll do what we can to help. You are also able to download a copy of your results once you have completed and you go to submit your assessment. So you'll click a button to submit it. And then this your particular screen, you can see in this screenshot will pop up. And at the bottom, there's an option for you to download your survey response, and you'll be able to download that as a PDF document. So you'll be able to have a copy of your gap analysis results to look at as well. And we will review the aggregate results of the gap analysis for the HCRIG cohort on Wednesday, September 1st. And as I mentioned earlier, we'll utilize that information to help further inform and customize our curriculum for this cohort moving forward. So we can meet you where you're at and provide education and resources and support that'll help you advance your fall risk reduction program based on your needs. So in summary for today, to briefly wrap us up, and then we can address any questions you might have. So action items moving forward, revisit the composition of your team. You know, who else in your facility might you want to engage with you in this fall's learning cohort? That might be something you do now, but also might be something you do once you've completed your gap analysis and have identified areas where you might want to focus some of your improvement efforts. And then please complete your fall risk reduction gap analysis by Wednesday, August 18th, to give us some time to go through all the collective results and work with the HCRIG program to identify those areas we can focus on moving forward. Here's our contact information listed on this slide. So I have Dana's contact information listed first as the HCRIG program coordinator, and then contact information for myself and other members of the UNMC team is also listed on the slide. With that, I guess, Dana, I'll turn it back over to you and we can take any questions you might have. You're welcome to share those verbally or place them in the chat as well.
Well, let's start there. Thanks, Vicki. That was a great overview and I think gets us set up to really be successful in the cohort. Does anybody have questions specifically for Vicki or me or about the project? Oh, I see a chat here. Is it possible to add additional team members? And if so, do we update the member form and submit to them? Yeah, that's fine. The most important thing about the team form is that key contact, because that is who Vicki and the Capture Falls team use for the gap analysis contact information. So as you add people to your team, if you just want to update me with the form, that's great. If the key contact changes so that that email of the gap analysis will be going to a different person, that'll be one to really make sure we're aware of so that that email link goes to the correct person. So that'll be really the biggest thing about the team makeup that will be right now important. But yes, that's perfect. If you want to update the form and send it to me, that's great. Other questions?
This is Ann Skinner. If you haven't submitted the form with your team members or the key contact on it, please, you can still do that. The survey that will be distributed around 12:45, someone that had registered in HCLIC will get the survey. So if you've registered, but you haven't identified a key contact, one person on your team that had registered will get the survey. And if you'd like to change that person, I guess contact Dana on that and just fill out that form and send to Dana.
And if you don't have time to fill out the form right now, just get me at least that key contact email so that we can make sure that link gets sent out.
Dana asked if the slides for today were sent via email to the group.
So I connected them to the meeting request or the Zoom invitation. If you didn't get them, just shoot me an email and I'll connect them to an email back to you. Can we download the gap analysis questions to ask to a team? I guess I don't know how that looks. Vicki, do you want to speak to that?
Yeah, Anne, can you address that question?
We can send out a PDF of a blank survey, I guess, to anyone who wants it. It might look a little daunting because there's fields that are kind of logic driven, but we can absolutely do that. Or else you could go through the survey, and at the end of the survey, there's an option to print the PDF of your gap assessment. So you can have that, but I think you might have to submit it before you do that. I believe we can make a PDF and maybe we could send that out to the group. If that's helpful.
I think that would be helpful just so people, if they want to take it to their team meeting and get some input before they go actually enter data, that might be useful. So if you want to send that to me, Anne, I can send it out to the group.
Okay, great. Thank you.
Sounds great.
Okay, next one is, if the gap analysis identifies a lack of effective fall risk reduction interventions in our facility, will this program be able to offer evidence-based approaches that we may implement in our programs, or does this cohort work together to come up with interventions that work, or both?
That's a great question. I'd say we'll probably, depending on what we learn from the collective and the gap analysis, we'll be open to both approaches. So sharing, what we know about evidence-based practices, but also leveraging all the collective intelligence and experience from the cohort that we have here to help troubleshoot and generate, opportunities for change and share what's working in our facilities as well. So I think the answer to your question is both.
I would like to add on to that. We also have on our Capture Falls website, we have a roadmap that has links to all kinds of evidence-based practices. So we really do appreciate those evidence-based approaches. So sometimes we find some things that worked at some other hospitals that may work at your hospital, and that's what's shared in the collaborative, just as Vicki had mentioned.
And I think, correct me if I'm wrong, Vicki and Ann, but one of our learning sessions will kind of do a overview of the Capture Falls website, and so that if there is a tool on there that maybe doesn't directly get discussed in one of the education pieces in this cohort, that there's other stuff out there for access and use.
Yeah, that's correct, Dana.
Awesome. Great questions. Great job. That's awesome.
Doug asked also, do you have the Capture Falls link already? I don't think I actually put it in the slides, which I should have. What you can do, someone might be able to drop it in the chat since my screen is shared. But you can also just Google Capture Falls Roadmap, and it'll be the first thing that pops up within Google, and you can click on Roadmap, and that will take you there as well. But I'll make sure we add that specific link to our future slide decks as well.
And I can also, when I send out the gap analysis PDF, I can put the link in that email as well, so that'll hit everybody too, so we can get it out multiple ways, make sure everybody has that. Oh, Ann just put it in there. Awesome. Thanks.
Perfect. Thanks, Ann.
All right. Well, if we don't have anything else right now, we're done about 5 minutes earlier than we planned. So just on your list of to-dos, Make sure that I know who your key contact is. That's the most important right now, and their email, so that we can get that gap analysis link out. I will get the PDF and the Capture Falls link all sent out to the group once I receive that. And then gap analysis, we want back by, what did we say? August 18th. Yes. Okay. So by Wednesday, August 18th, if you can have that completed and back to the team. So you'll complete it through that link that's sent out to you, and that will go back to the Capture Falls team for them to assess and do the work their magic with. So
yeah, if you can complete by Wednesday, August 18th, that will give us 2 weeks to work our magic with all the gap analysis results before our third meeting on September 1st, where we'll kind of review collectively what we've learned from the cohort about what's working well and what are some of those areas where we can focus on for improvement, which will help kind of set the stage for our improvement efforts moving forward.
So next meeting will actually be that August 18th date, noon to 1. We'll come back together, and then specifically then we'll come back together again on September 1st and talk about results of the gap analysis. So lots happening, lots coming up. I know everybody's busy, so thanks for participating. And if you, can get that stuff all in as soon as possible, then we can really make some actionable plans moving forward. All right, if there's no other questions, I'll let you guys get back to your day and reach out to myself or to any of the Capture Falls team with questions. And watch for a few more emails coming out in relation to this work, and we'll get going on it. I'm excited. I think this will be really good.
All right, thanks, Dana. Thanks, everyone.
Thanks, everyone. Have a good day.
Questions